Sometimes doctors refer to you lumps in the body, and you come back with a diagnosis of Hodgkin's and non-Hodgkin's lymphoma. What is that?
Those are essentially the cousins, if you want, of leukemia. It's a form of cancer. Involves cells that are fairly similar to the one that we discussed briefly for the acute lymphoblastic leukemia, but they present themselves in a different fashion. The cells don't tend to be all over the bodies, but they tend to be more localized in big lumps in the lymph nodes and in other organs that are involved. The Hodgkin's is sort of a second cousin because it's a little further away from leukemia. Some of the so-called non-Hodgkin's lymphoma are almost interchangeable with leukemia itself.
Why do we distinguish between the word Hodgkin's and non-Hodgkin's? How is that distinguished?
Because the one disease tends to be somewhat more aggressive and some tends to be a little bit more indolent, not as fast growing.
Which one?
The non-Hodgkin's lymphomas tend to be generally more aggressive in a child, while instead the non-Hodgkin's can be a lump that may have been felt for months. Patients may have not paid a lot of attention to it, and it takes a while sometimes to even come up with the diagnosis because it tends to not necessarily be so symptomatic.
Are we winning the battle against these particular types of cancers?
Yes. These diseases, as well as leukemia, have a very high rate of cure. And when we say cure, we, by the way, mean the fact that the disease does not come back. This is not a remission. This is not a...
How high is the rate?
The rate of cure in these diseases is very similar to leukemia. It's in the 85, for some of them even 90%. Both non-Hodgkin's lymphomas as well as Hodgkin's disease have a variety, comes in a variety of colors and taste.
Some of these lymphomas can have late stages and still be cured, can't they?
That's correct. Even disseminated disease is highly curable in a number of circumstances.
It depends on the response of the medicine, is that correct?
That's correct. And even actually patients who fail, who have what's called a recurrence, often enough there is a very good hope with additional treatment that we can cure these patients. As a matter of fact, it's relevant to say that, for instance, in a situation like Hodgkin's, where in the old time radiation therapy was the mainstay of treatment, we're now moving back. We're trying to give less treatment because of the potential toxicity, because we know that the combination of different drugs actually can do the job as well and sometimes potentially better. So,
has this been coming out of this cooperative study amongst all the hematologists?
Yes, a lot of this information and the results have come out of studies.
So we're sort of like fine-tuning what we're doing?
At the moment, if you look at where we are in cancer medicine, is we have, in spite of the press that has occurred recently, very few really new drugs. What we're doing right now, aside from looking very hard for new drugs, is to actually fine-tuning and understanding better how to manage these patients with the drugs that we have had for a very long time. And that's important because we are trying to achieve the same results, the same high level, degree of cure with the less problems, less complication, less destruction of normal tissue. And that's an important aspect.
There's a lot of myths